Chapter 14: Risk Factors in Inflammation and Links to Chronic Diseases. All right, way back in the early 1900s and even beyond that, in the 1800s and before, most of the diseases that we developed were infections, right? From tuberculosis or pneumonia, it's some type of bug that we got or virus that we developed a certain disease. Nowadays, because of our lifestyle, we tend to develop chronic or degenerative diseases such as cardiovascular disease, cancer, and also respiratory diseases as well. These ones can be delayed or prevented based on our lifestyle. So if we're inactive, if we become active and physically active, we can prevent or delay some of these diseases that we can develop if we have a bad lifestyle. And the same thing with nutrition as well. If we have a bad diet, high fat diet, high cholesterol, high sodium, and not a lot of fruits and vegetables, we can develop diseases as well. All right, and this is uh, a lot of times behavioral if you want to look at it that way. All right, so we can delay it or prevent it. And you can also think about certain ways of why it's changed over time. The big one would be technology. We don't have to walk everywhere or ride a horse, which are activities that would burn a lot more calories than sitting in a car and driving somewhere, or just simply riding somewhere. Also, technologies such as computers have also done this as well. All right, so the book outlines some major risk factors for developing heart disease and also other diseases as well. And this figure is in your book. So we have three categories here: either inherited, biological, environmental, and behavior. So let's look at inherited or biological. All right, so these are some things that we can't necessarily change. So age. Older individuals tend to develop chronic diseases more so than younger individuals. For gender, men, one example of this would be that men tend to develop cardiovascular disease much earlier than females. For race, African Americans and also Hispanics tend to have a higher incidence of diabetes and high cholesterol, and then also that can lead to heart disease as well. For the environmental portion, for the physical environment, we're talking about dirty air or water in terms of health, but noise and unsafe highways could cause injury. Noise being, um, maybe hearing damage, unsafe highways causing injury or death. Socioeconomic status plays a big factor in developing certain diseases, and that goes along with income, employment, education. Um, as you uh, as you may see in a lot of restaurants, especially fast food restaurants, it's really cheap food, but it's not all that great food. It doesn't. It's not necessarily nutrient dense with the right nutrients that we need, such as a lot of vitamins and minerals and lean meat. All right, a lot of that stuff might be a little bit more expensive. All right, so if a lot of people go to fast food restaurants, McDonald's, Burger King, Wendy's, wherever it may be, because that's cheap food. It doesn't cost a lot for an entire meal. All right, definitely cheaper than going to the store and maybe buying fresh fruit and vegetables every couple days, because that stuff tends to get old after a while. Old meaning moldy and go bad, and it gets more expensive than does a quick meal like that. Also, it lists family under here. The stress and possible depression of divorce or a death of a loved one, or maybe if you're a parent, your child leaves for college, or just moves out of the house. Some of the stress that goes along with that could start to hinder on your health. Also, another thing with family, and this kind of plays into behavioral, is that I believe that the apple doesn't fall far from the tree. You see that in a lot of different parameters. Um, but in a lot of cases, you'll see it in physical activity and nutrition. And that if the parents are unhealthy in terms of their lifestyle, they're less physically active, they don't eat very good, their children are more likely going to be um, not exercising and not having a good diet as well. So let's talk about behavior. Smoking is the number one cause of preventable death in the United States, and it could be in the world as well, but it is definitely in the United States. Poor nutrition is the second leading cause of preventable death. Alcohol, especially binge drinking, we're not talking about maybe one or two drinks a day or a glass of wine. We're talking about binge drinking, getting drunk all the time can lead to certain diseases, especially within the liver, because the liver is the main pathway for alcohol metabolism. And then inactivity. Inactivity is obviously really huge in helping to prevent some of these diseases. And physical activity can help prevent a lot of diseases, or at least delay them, and help at least delay the symptoms of them. In the top four here, if you read any article, it doesn't really matter what magazine, any reputable article that talks about a healthy lifestyle, it says don't smoke, eat right, don't drink a lot of alcohol, and exercise. All right, and that essentially will help you become a healthier individual if you do those four things. All right, and these can help prevent or delay diseases. All right, these are behavioral. They can change. You can change these behaviors. Overuse of medication, either also with drugs, recreational drugs, or prescription drugs. And the fast driving and no seatbelt, again, can cause injury and death. It's not necessarily related to physical activity or overall health, but it is risk that you're putting on yourself. Now, these can be changed, these behavioral ones, but keep in mind that the biological cannot be changed. You can't necessarily change your genes, all right? But these factors can help augment some of the susceptibility that you have to certain diseases because of your age, your gender, your race, also your environment as well. You can somewhat change these. For the physical, the air, water, the noise, if you have the means to, you could move to a different area. You could look for a better job, right? Better employment. For the family, sometimes it's not necessarily something you can change too much, but there's obviously ways you can cope with it and get some help dealing with issues. All right, the book also gives this diagram of the web of causation for atherosclerosis, and this is going to be the buildup of fatty plaque within the walls of the arteries that can lead to a heart attack or stroke. And if you look at this, genetics encapsulates this whole thing. All right, so let's kind of look at these. And these different categories are in here that we looked at in this one. So let's look at them. So the inherited or the the biological would be the genetics, access to high fat, and also inexpensive food. That would be possibly an environmental factor. And then you have a behavioral factor of ingesting more calories than you need and more fat content within the food. Then another part of the environment would be you could possibly have bike trails and parks and sidewalks and maybe fitness centers and gyms located near you to help increase your physical activity. But if you choose not to do that, you're going to become physically inactive, which can lead to high blood pressure, high blood lipids, type 2 diabetes, obesity, being overweight, and all of this could possibly then lead to atherosclerosis, which essentially is coronary heart disease. Again, smoking here is the number one preventable cause that is behavioral, and we have these diseases here. Overweight and obesity is looked at as a disease. It is at least an epidemic anyway. Um, it may not be a true definition of a disease, but it is preventable for the most part. Hypertension, high blood lipids. This is also known, high blood lipids, also known as hyperlipidemia. Then type 2 diabetes and atherosclerosis then. So you can kind of get a visualization of how they're all related. But again, genetics plays a role in a lot of this. You could have a family history of hypertension or type 2 diabetes or even type 1 diabetes. You could also have a family history of cancer. And a lot of that stuff you can't change, but you can augment some of the at least responses and at least the time that you might develop that disease by increasing your physical activity, eating good, not smoking, and not drinking a lot of alcohol. All right, coronary heart disease. Like I said, it's going to be atherosclerosis a lot of times is what's going to be the underlying factor of what causes the heart disease. All right, and this is going to be a thickening and the narrowing of the coronary arteries, and it's going to be a fatty plaque buildup, going to be basically within the the first layer of tissue within the arteries, and we'll see that here in a second. It is the major contributing factor to a myocardial infarction, or MI, which is also known as a heart attack or stroke. And this heart disease is also the number one cause of death in the United States, all right, in both men and women. All right, a lot of times we think of different cancers maybe being the number one cause of death in either gender. But for both genders, it is heart disease and cardiovascular disease that is the number one cause of death. And there's a lot of cases where it is preventable. All right, one study to keep in mind that helped all of us kind of understand better the risk factors and how we develop coronary heart disease, all right, and how they're linked. So they found the links between the risk factors, smoking, hypertension, cholesterol, and the development of coronary heart disease. And a lot of these risk factors are kind of related. If you have a high fat diet, more likely you're going to have a high cholesterol content within your blood, which then can possibly cause hypertension. Okay, if you are physically inactive, you're more likely going to have hypertension or high blood pressure, and you could possibly have a high cholesterol as well with that. So a lot of these things are kind of related. Smoking can cause a bunch of different factors, not only hypertension and possibly high cholesterol, but also pulmonary disorders as well. The risk for developing coronary heart disease increases as you increase the risk factors, either the number of risk factors that you have, or the magnitude of those risk factors. So the higher your hypertension is, the higher your blood pressure is, or the higher your cholesterol is, the greater the risk is for developing coronary heart disease. But if you reduce those risk factors, you can cause a reduction in the risk, right? Exponentially, especially if you take out smoking. If you stop smoking, you can greatly reduce your risk for developing coronary heart disease by lowering your blood pressure, your cholesterol. Also, your breathing pattern tends to get a little bit better as well. So physical inactivity as a risk factor, it can be looked at as an independent risk factor for developing coronary heart disease, because it's not really related. No other risk factor kind of causes it. All right. Now, physical inactivity may cause another risk factor, such as high blood pressure, at least indirectly. But smoking doesn't necessarily cause physical inactivity. High blood pressure doesn't necessarily cause physical inactivity. So it's kind of independent of all these other factors. The relative risk for being physically inactive is similar to that of smoking, high cholesterol, and also hypertension. As you can see from the figure, which is in your book, this risk ratio of 1.9 means that someone who is physically inactive is almost twice as likely to develop heart disease than someone who exercises 3 times a week, just 20 minutes a day. All right, so it's fairly close to all these other risk factors, even smoking as well. And as you can see, nearly 60% of the population in the United States is at risk for developing coronary heart disease because of physical inactivity. Now, one of the good things in the past 20 or 30 years or so is the amount of smoking has decreased. So 20 or 30 years ago, this number may have been a little bit higher. It may have been 20-30%. Right now it's below 20. But if you do smoke, you're 2.5 times more likely to develop coronary heart disease. Now, looking at physical activity, those adaptations that occur when you're physically active and exercising can cause a reduced risk for developing CHD. You have an increased glucose tolerance, all right, decreasing the symptoms associated with diabetes, also increase in fibrinolysis, or the clot clearing properties within the arteries. You can also have a reduced blood pressure. Think back over the past few chapters, we talked about as you exercise, one of the adaptations that occurs is a decrease in the total peripheral resistance due to a number of different factors, and that altogether can help reduce your blood pressure. Inflammation and coronary heart disease. So looking at atherosclerosis again, we'll get into the process of how this develops here in a second. So it's caused by an inflammation in the inner linings of the artery. All right, and it's going to be a response to tissue damage. Either there's going to be some type of little tear or scrape within the artery that causes an inflammatory response, which is normal. It occurs in every single one of us. All right, but what's different between someone who maybe has a healthy lifestyle, a healthy diet, doesn't smoke, doesn't drink a lot of alcohol, is going to be that response and what occurs after that inflammation. So we're going to have a recruitment of leukocytes, which is essentially the white blood cells within the blood. And we can get this fatty plaque buildup within the lumen, or empty space in the artery. So this develops into a narrowing of the artery, and that plaque that's built up can rupture and cause a clot or a thrombosis, causing a myocardial infarction and or also known as a heart attack. So let's look at the process of atherosclerosis and leading towards a heart attack or stroke. So there's going to be some type of activation in the endothelium, which is the lining of the artery. And these are going to attract monocytes within the white blood cells. They'll make their way underneath that first layer, the endothelial tissue, and mature into macrophages, which look back, we looked at damage within the muscle fibers. Macrophages are important of eating up and clearing debris, and this essentially does a similar thing. It scavenges LDL-C, which is low density lipoprotein cholesterol, otherwise known as the bad cholesterol in lay terms. So these macrophages keep taking in a lot of this LDL that has a lot of fat and cholesterol within it, and this develops into what's known as foam cells. It causes like a fatty streak and a fatty deposit underneath the endothelial tissue. The plaque size then will increase and it will keep getting bigger and bigger. And what also happens, the smooth muscle will replicate and join with connective tissue within the endothelial layer and cause a fibrous plaque buildup over top of this foam cell. Then eventually there's going to be some type of inflammatory response that will trigger a rupture, and that's where we can get a clot formation leading to a heart attack or stroke. So this is a figure from the book. So again, this is the lumen, the hollow cavity portion of the artery, and that little wee layer is the endothelial tissue, which is right here. And we're going to be concerned, I guess, a lot with the intima, which is directly right underneath the endothelial tissue. So the endothelium is going to be activated by certain risk factors: smoking, hypertension, high-fat diet, obesity, being overweight, and it causes it to develop adhesion molecules. And as these monocytes are floating by, because of some type of inflammatory response due to injury within the endothelial layer, so as they're floating by, they'll hook onto the adhesion molecules and they'll work their way into the intima, past the endothelial tissue. And they'll develop, you can see these little green markers on the edge or the outside of the macrophage. These are scavenger receptors. And the LDL-C, the little yellow spheres, will bind to these and work their way inside the macrophages, so the macrophages kind of eat them up, and they'll continue to build up and build up and build up and develop into foam cells. Right, essentially it's saponification, or making soap. All right, that's essentially what soap is a bunch of fat. So that's kind of why it gets foamy. And that's essentially what's happening here. So it builds up and gets bigger and bigger. And at some point we're going to have a disruption. But first let's talk about the cap here. So we have the smooth muscle tissue that combines with some fibrous tissue that creates a cap. all right, or a little layer over top of those foam cells, that fatty deposit. Now, at some point, the foam cells then are going to release inflammatory signals. There's going to be some type of inflammatory response that occurs. This can then weaken the cap that's over top of this fatty deposit, and there can be a rupture, which causes the thrombosis. All right, basically leaking out of all this stuff. All right, and there's a lot of fibrous tissue and foam that's coming out, and it can block the artery. And this is what causes a heart attack then. It can also cause a stroke as well. All right, let's look at the excuse me. Let's look at the obesity inflammation. All right, so let's look at obesity, inflammation, and chronic disease and how they're all interrelated here. The adipocytes, which are the fat cells, they will secrete cytokines, and there's going to be a couple different cytokines that are released: TNF alpha and interleukin 6. These are inflammatory. All right, so they cause inflammation. All right, they cause a progression towards inflammation, and they're released as you increase the amount of visceral fat or the amount of visceral adipocyte size. Adiponectin is anti-inflammatory, so they're released when adipocyte size is low, and therefore if you have an increase in adipocyte size or increase in fat storage, the release of adiponectin is decreased. So basically, to sum this up, as you increase the amount of fat that you have, at least total body percentage of fat and total fat mass, you increase your inflammatory cytokines. Right? And cytokines are basically just endocrine messengers, basically telling the system what to do. So someone who has a high amount of fat, you're going to have more inflammation than someone who has low amount of fat, because they're going to be releasing more of the adiponectin and less of the TNF alpha and the interleukin 6. It can also cause insulin resistance. So along with these reactions up here, the increased release of TNF alpha, interleukin 6, the decreased release of adiponectin, and the insulin resistance that you have, so developing diabetes, you also have an increase in free fatty acid release within the adipocytes. So you have more inflammation, you have more fat within the blood, and you also have insulin resistance. So not a good situation. And this is how obesity then can possibly cause coronary heart disease. Now you also have C-reactive proteins that are released as well. Now they're not necessarily a cause of atherosclerosis, but they are a marker for inflammation. And it can be looked at as a risk factor, but again, it doesn't necessarily cause it. It is just a good marker for it. All right, drugs, diet, and physical activity. So there are some certain drugs that could be prescribed that can help um, reduce the risk factors, especially if they're genetic. If you have a good diet and exercise often, and you still have high cholesterol or high blood pressure, there are certain drugs that you can take to help reduce those risk factors. One of them would be statin drugs, and they help lower cholesterol, more specifically, help lower LDL cholesterol and also C reactive proteins. And they essentially block the production of cholesterol in the liver, therefore reducing the risk of developing coronary heart disease. And in fact, one of the first studies that was done on one of the earlier drugs to help fight high cholesterol actually ended early because they seen that the individuals that took the drug down here greatly reduced the risk for developing coronary heart disease, or at least heart attacks as well. And the individuals who had placebo were still a lot higher. So there was a 44% reduction by taking this drug. And this was a statin drug. So moving on to diet, the Mediterranean diet that have a lot of fruits, vegetables, legumes, a lot of peanuts, nuts, almonds, whole grains, and olive oil actually help lower interleukin 6 and also C reactive proteins. And this is one of the conundrums that a lot of people who were maybe on uh, high protein diets, maybe low carbohydrate diets, is they seen individuals who were on a Mediterranean diet who had a lot of fat and carbohydrates. Olive oil has a high fat content. Actually, that's what olive oil is. It is fat, essentially. But there's a lot of what's known as polyunsaturated fats in it. Whole grains, that's carbohydrates. Legumes, there's some protein, also a little bit of carbohydrates in there. But fruits and vegetables, that's carbohydrates, right? And especially fruits and vegetables that will also have a lot of fiber in them as well, which is also known to help reduce certain cancer risks. But going back to the olive oil, it has, again, polyunsaturated fatty acids as opposed to butter, which has a lot of saturated fat. And that polyunsaturated fat um, is more beneficial to you. All right, and actually, it contains some fats that we actually need in our diet that our bodies cannot make. And someone that's on a low carb diet is normally going to have a high protein, high fat content within their food, and they're actually at a higher risk for developing certain diseases because they're getting more of that fat in there. Now, physical activity, obviously exercise, there's an induced inflammatory reduction because of exercise and regular physical activity. Now, also, interleukin 6 can be released because of exercise and physical activity, but the type and the different form of interleukin 6 that's released during exercise is anti-inflammatory. Physical activity can also reduce the release of TNF alpha. So again, all this together helps reduce the risk for developing atherosclerosis and therefore leading to heart attack and stroke. So again, the diet, especially something similar to the Mediterranean diet and physical activity, are behaviors. Or we can look at them in the behavioral realm. We can change this. If we're not having a good diet, we can change our diet. If we're not physically active, we can become physically active. The drugs are there primarily because of certain genetic factors, all right, and biological factors that are occurring. All right, metabolic syndrome. Metabolic syndrome is defined as three or more of the following risk factors. So you either have abdominal obesity, and this is defined as a waist circumference of greater than 102 centimeters for men and 88 centimeters for women. Hypertriglyceridemia. This is also known as hyperlipidemia, and it's also much easier to say. You have a low HDL cholesterol. HDL would be high density lipoprotein. This is the good cholesterol. High blood pressure, also known as hypertension. Also high blood glucose. Now you don't have to know the different numbers for these. I just want you to know, three or more of these is metabolic syndrome. In fact, this one I actually forgot to put the blood glucose. So I believe it is about 90 or 100. Also with the low LDL-C, if you have a high LDL-C, low density lipoprotein, the bad cholesterol, could also be a risk factor for developing metabolic syndrome. All right, so let's look at the metabolic syndrome in a little bit more detail. So you could have insulin resistance with this. So a reduced ability of the peripheral tissues to take up glucose, right, which leads to type 2 diabetes. And what can happen is the pancreas can't secrete enough insulin to take up glucose. Insulin is important for the tissues to take up the glucose to use it for fuel. And if you don't have enough insulin, then you can't take the glucose and transport it into the cell. So it leads to hyperinsulinemia, where the pancreas starts to secrete more and more and more insulin. You have an increased fatty acid level within the blood as well, and this is increased with increased abdominal obesity. Now, along with the fatty acid levels within the blood, insulin can help increase fatty acid, or can help decrease fatty acid levels within the blood. But there could be a hindrance of that with the obesity because the insulin is used for the glucose to be brought back or be taken up into the tissue cells. So there's a lack of insulin used for fatty acids. So the hyperinsulinemia, there's going to be increased sympathetic nervous system activity. So you have increases in epinephrine, norepinephrine, which then lead to an increase in heart rate, increases in stroke volume, and an increase, therefore, in blood pressure. So just because we have more insulin within the blood, we have a high amount of it, it can lead to high blood pressure because of that increase in heart rate, increase in stroke volume. This sympathetic nervous system activity also can help hinder the release of insulin. All right, because it's trying to, the body says that we have too much insulin, we need to dial it back a little bit, but we still have a lot of this glucose floating around, so we're going to have a high blood sugar count, and it leads to obviously diabetes. So because we have an increased sympathetic nervous system activity because the pancreas is releasing more insulin. We also have increased sodium and water retention, which increases blood volume, plasma volume, and subsequently increases blood pressure. Also, an increased smooth muscle proliferation within the blood vessels, so they begin to multiply more and more, and causing a increased resistance to the blood flow within the arteries. So if we look over here in this figure from the book, you can kind of see how some of this is related. So the hyperinsulinemia, increased sodium and water retention, altered blood pressure or blood vessel structure, which increases blood pressure, and increased sympathetic nervous system activity, which then also increases blood pressure. And the peripheral insulin resistance then can cause the elevated triglycerides. We talked about that up here with the increase in fatty acids within the blood because of the abdominal obesity and the increased hyperinsulinemia. Can lead to type 2 diabetes, and this all goes back to exercise, at least lack of exercise and a poor diet, but also some genetic factors as well. So what causes it? So possible causes: insulin resistance. So changes in blood and water retention causes the hypertension. Because you have this increase in plasma volume, increase in blood pressure, and also a decrease in the delivery of insulin and then subsequently glucose into the cell. The underlying factor could be hypertension itself, so that could be the main centralized factor. So the decrease in the small blood vessels reduces the glucose and insulin delivery to the muscles and other tissues. And this can then cause insulin resistance. So we have somewhat of a paradox in theories of what's going on here. I mean, they're all interrelated, but we're still trying to figure out exactly which one causes what. It's that chicken or the egg question. Could also be increased sympathetic nervous system activity. So increasing blood pressure and blood glucose, which then causes the hypertension, which then causes the insulin resistance. Or the entire thing could just be obesity itself. And then as you increase adiposity, you're going to increase your risk for peripheral insulin resistance, elevated triglycerides, developing type 2 diabetes, and you have the hyperinsulinemia, you have the hypertension, you have the increased sympathetic activity. So 4 theories that have centralized factors surrounding them. All right, but they're all 4 related somehow. All right, now the authors also went into a little bit of detail about some other factors and other theories of what causes the metabolic syndrome. You can have low-grade chronic inflammation. So you have an increased TNF alpha, interleukin 6, and CRP, C-reactive proteins, that cause the insulin resistance. And this leads to obesity and type 2 diabetes. You could also have a central obesity. Again, somewhat going back to the last slide where obesity was at the center of all this, where you have an increase in inflammatory cytokines, an increase in free fatty acids released in the blood, and then this can cause insulin resistance. They also state that oxidative stress can be a factor in all this as well. So free radicals cause the cellular damage, DNA damage, and also increase inflammatory responses. And as we've seen in one of the previous chapters, as we exercise, one of the responses and adaptations is we increase the amount of antioxidants that are produced that neutralize the free radicals, thus reducing the amount of cellular damage and inflammation that can be caused from the free radicals. So we have an altered inflammatory response because of exercise. Now the authors also, and I think that they actually coined this term, cardiovascular metabolic syndrome, because essentially this is all leading up to problems within the cardiovascular system, specifically the heart and the arteries of the heart. All right, so all this is essentially going to lead to some type of heart disease. All right, now there's going to be other problems along the way, but essentially it's going to be heart disease at some point in atherosclerosis. So then you have the prevention and treatment of the metabolic syndrome, and they kind of sum this up in a nice figure at the end of the chapter, or towards the end of the chapter. This is actually a good diagram of kind of summarizing what all is going on here. So medicines are developed and they could actually help treat the metabolic syndrome. Regular physical activity, healthy diet can obviously help to reduce some of the risk factors, reduction in weight, and at least specifically there, we need to be a little bit specific when we talk about weight. It's mostly going to be related to fat mass, not necessarily muscle mass. Actually, if you increase your muscle mass and decrease your fat mass, it'll be greatly more beneficial, which is why weight training is also an important part of exercise. And we'll see that a little bit in the next chapter as well. And we have genetics, age, and gender that can affect weight and also some of these symptoms. So again, all this fat, body fat accumulation, insulin sensitivity, glucose intolerance, LDL, HDL, triglycerides within the blood, blood pressure, thrombosis, low-grade inflammation, and endothelial function within the arteries. All these factors play into whether you're going to develop or an individual develops type 2 diabetes, and atherosclerosis, and leading to myocardial infarction, stroke, and also peripheral artery disease as well. But medicine, physical activity, healthy diet, and also reducing the amount of fat mass that an individual possesses can control these risk factors and therefore control the risk for developing heart disease, which leads to MI or stroke. So that was chapter 14, risk factors and inflammation, links to chronic disease. If you have any questions, feel free to ask. Thanks.